They said the nurse is caring for a client with B thalassemia major. Which therapy is used to thalassemia? A. IV fluid. B. Fluid blood transfusion. C. Oxygen therapy. And D. Iron therapy. So if I ask you, what is thalassemia? So thalassemia, it is the genetic defect or inherited blood disorder characterized by the formation of abnormal form of hemoglobin, and it causes the tiredness, yellow discoloration of the skin, dark urine, and abnormal swelling and facial bones deformities, right? So if patient have it, about the management of the thalassemia or treatment of thalassemia, what should do? IV fluid, frequent blood transfusion, oxygen therapy, and iron therapy. So correct answer is a frequent blood transfusion, right? Used to treatment. So thalassemia is a genetic disorder, as I told you, that causes the red blood cell to have a shorter lifespan. So red blood cell easily broken. So frequent blood transfusion are necessary to provide oxygen to the tissues. So answer A, IV fluid, incorrect because fluid therapy will not help. Answer C, oxygen therapy is incorrect because oxygen therapy will also not help. And answer D is incorrect because iron should be given sublingually or oral form because this client do not use the iron store adequately. So next question goes, the child with a history of respiratory infections and has an order for a sweat test to be done, which finding would be positive for cystic fibrosis? So number is said a serum sodium 135 milliequivalent per liter, B a sweat analysis 69 milliequivalent per liter, C a potassium 4.5 milliequivalent per liter, and D a calcium of 8 milligram per DL. So the correct answer is here is B, right? The sweat analysis of 69 milliequivalent per liter. So cystic fibrosis, a genetic disorder in which the lungs and digestive tract system get involved, and particularly the mucus secreting cell get involved. Usually patient present with a group of complications. Cystic fibrosis affects the cell that makes the mucus, sweat, and digestive fluid. And these fluids are thick in cystic fibrosis patient and causes the blocking of the duct throughout the body and lead to a range of symptoms. The lungs and digestive systems are the main area that are affected. Usually the symptom may appear soon after the birth or early childhood in most of the cases. Usually patient present with a persistent cough or salty taste skin, also sneezing, shortness of breath, sinusitis, inability to exercise, right? In case of men, Male infertility is common, also repeated lung infection. So why sweat test? Because cystic fibrosis is a disease of the exocrine gland. The child with cystic fibrosis, their sweat or their skin will be salty. A sweat test result should be more than 60, means 60 milli equivalent per liter. It is more than the normal range, or higher is considered positive. Answer A, C, and D are incorrect because these test results are within the normal range and are not reported on the sweat test. What next? Here, the nurse caring for a child with a large meningomyelocele is aware that the priority care for this client is to A, cover the defect with a moist, sterile saline gauze. B, place the infant in a supine position. C, feed the infant slowly. And D, measure the intake and output. So the correct answer is cover the defect with moist and sterile saline gauze. The patient has a meningomyelocele. Meningomyelocele is an opening in the spine. The nurse should keep the defect covered with a sterile saline gauze until the defect can be repaired. So answer B, place the infant in a supine, or is incorrect because child should be placed in prone position, never supine. Supine position means when you lie down on back. Prone means when you lie down on the abdomen. And answer C is incorrect because feeding the child slowly is not necessary. And answer D is not correct because this is not the priority of care. What next? The nurse is caring for an infant admitted from delivery room, which findings should be reported. A, cyanosis, acrocyanosis, or help sign also absence the femoral pulses. The correct answer, absence the femoral pulse. Why? Absence femoral pulses indicate the coarctation of aorta, and this defect causes the strong bounding pulses and elevated the pulse pressure in the upper body, right? And low blood pressure in the lower extremity. Let me recap it. I said absence the femoral pulses indicate coarctation of aorta, and this defect causes the strong bounding pulses and elevated blood pressure in the upper body and low blood pressure in the lower body or lower extremity. Answer A, acrocyanosis or acrocyanosis, acyanosis or acrocyanosis. A, B, and C, they incorrect because they are not normally finding in the newborn. What next? So here the nurse is aware that a common mode of transmission of Clostridium deficit infection, right? Clostridium deficit infection. Number one, use a unsterile surgical equipment. B, contamination with sputum. C, through the urinary catheter and contaminate the stool. So we have to choose one, but the most common mode of transmission, right? So correct answer is D, contaminated through the stool, because this is a Clostridium deficit. Clostridium deficit is primarily spread through the GI tract, gastrointestinal tract, resulting from poor hand washing and contaminated with the soil containing Clostridium deficit. Answer A, B, and C are incorrect because the mode of transmission is not by sputum, not by catheter, right? Also, not by through the urinary tract or by the unsterile surgical equipment. What next? The nurse has received the change of the shift report, which client should the nurse assist first. So this question about the prioritizations. Receive the change shift report. A client 2-hour post lobectomy with 150 milligram drainage. A client 2 days post gastrectomy with scanty drainage. C, a client with pneumonia with an oral temperature 100 or 2. And D, a client with a fractured hip in butt traction. So correct answer is A, client 2 hours post lobectomy with 150 ml drainage. 2 hour. Patient 2, 2 days post gastrectomy and scanty drainage. So it is okay. It is stable. The client with pneumonia with an oral temperature 100 or 2. It is expected. Number D, a client with a fractured hip and under the traction, nothing wrong. But this patient only 2 hours ago, after the surgical operation in the lungs, we call lobectomy, remove the part of the lobe of the lung, and also 150 ml drainage. It is important to take care of this assessment and notification to the doctor. So the first client to be seen is the one who recently returned from surgical operation room. And other client here, like B, C, and D, are most stable and can be seen later. What next? A client has been received the cyanocobalamin injection. It is the vitamin B12, other name. We give it to the patient who have pernicious anemia. For the past 6 weeks, which laboratory findings indicate that the medication is having the desired effect? A, neutrophil count 60%, B, basophil count 0.5%, C, monocyte count 2%, and D, reticulocyte count 1%. So the correct answer, cyanocobalamin deficiency occur in pernicious anemia, right? And anemia occur because of the lack of or reduce the number of red blood cell, RBC, red blood cell. Because of this, patient develop anemia. And in case if the intrinsic factor of cassette is less, or patient have a partial gastrectomy, vitamin B12 deficiency and patient develop pernicious anemia. And if patient have a anemia, we give them vitamin B12, right? And when vitamin B12 is more, RBC production go up. But RBC, one of the stages is called reticulocyte count. Neutrophil is a WBC. Basophil and monocyte, one kind of white blood cell, right? But the correct answer from here, it is number D, right? Number D is the correct. Cyanocobalamin is a B12 that is used in pernicious anemia, and reticulocyte count 1% indicate that it is having desired effect. Answer A, B, and C are white blood cell and have nothing to do with medication. What next? The nurse is providing discharge teaching with a client who is taking disulfam, shortly called antabats. So the nurse should instruct client to avoid eating, right? Avoid eating what? One, peanut or date and raisin. B, chocolate, eggplant. C, salad. Then beef. Or D, milk, cottage, ice cream. So answer is salad, dressing, and beef. Why? The client who is taking antabas or disulfam should not eat or drink anything containing alcohol or vinegar, right? Vinegar containing dressing. So the other food in answer A, B, or D are allowed. What next? A 70-year-old man who is recovering from stroke and exhibit the sign of unilateral negligence. Which behavior is suggestive of unilateral neglect? A, the client is observed having shaving one side of his face. B, the client is unable to distinguish between two tactile stimuli presenting simultaneously. And so the client is unable to complete a range of vision without turning his head side to side. And D, the client is unable to carry out cognitive and motor activities at the same time. So the correct answer is E, means the client is observed the shaving only one side of his face, unilateral negligence or neglect. The client with unilateral neglect will neglect the one side of the body. So B, C, and D are not associated with unilateral neglect. Next question. The client with the acute leukemia and develop a low white blood cell count. In addition to the institute of isolation, the nurse should do what? Number A, require that the food be served with disposable stuff, and ask the client to wear a mask when visit the patient present. And also preparation are beside with a mild soap and water and alcohol, and they provide the food in sealed single serving package. So what are the correct answer? Right? The correct answer is D. Provide the food in sealed and single serving package. Because the client is immune suppressed, acute leukemia, low white blood cell count, immunity is so bad, immunity is suppressed, immunity collapse. So chance of infection spread easily. So immune suppressed or food should be served in a sealed container to avoid the food contaminant or contamination. Answer B is incorrect because possible infection from visitor, right? And answer A is not necessary, but if you use, should be cleaned thoroughly and also raised in the hot water. Answer C might be a good idea, but alcohol can be drying and cause the skin breakdown. Next, a new nursing graduate indicate in starting entire that he is a licensed registered nurse. And although he has not yet received the result of the licensing exam, the graduate action can result in charge of fraud, be tort, malpractice, and negligence. So correct answer is a fraud. Identifying onset as a nurse without a license defraud the public and can be prosecuted. A tort is a wrongful act, right? And malpractice is a failing to act appropriately as a nurse or acting in a way that harm comes to the client. And negligence is failing to perform care. Therefore, answer B, C, and D are incorrect. What next? The nurse is assigning staff for the day, and which client should be assigned for nursing assistance? Who is stable? Or the person who need only the skill work? A 5 months old with bronchiolitis, 10 years old today's post appendectomy, a 2 years old with periorbital cellulitis. Number D, a 1 year old with fractured tibia. So out of 4, which one is most stable patient? This is the answer. So 1 year old with a fractured tibia, which is not stable, maybe inside bleeding occur, pain. So nursing assistance is not good. 2 years old with periorbital cellulitis, right? Cellulitis or abscess, infection, periorbital area, not stable. 5 months with a bronchiolitis, need to assessment, need to check saturation of oxygen, maybe need to give oxygen therapy. A 10 years old, 2 days, already 2 days is gone after appendectomy operation. So this is the stable patient, and so we can give it to nursing assistant, take care of it. So the client with the appendectomy is the most stable of this client and can be assigned to the nursing assistant. The client with bronchiolitis has an alternation in the airway. The client with the periorbital cellulitis has an infection, and the client with the fracture might be an abused child. Therefore, answer A, C, and D are incorrect.